If you don't get something right, just give me a shout. I would repeat what I've said. So my name is Izzy. I'm a GP. I have been a GP for 5 years. I've been a doctor for 14 years. I practice in Reading. I'm a wife. I'm a mother of 3 very beautiful children. And yeah, and I'm also a follower of Jesus. Like, he's my best friend. So you might see some things in that light. Well, I'm very passionate about preventing chronic illnesses. It's something that breaks my heart when I see people like really struggle with things I know that they could have prevented. So it's something I'm very willing to share what I know, and I hope that it will be beneficial to everyone. So we're just going to dive right in and, just have it's not very interactive. So I'm going to ask people to, comment in the chat box and let's just share our ideas together so no one falls asleep. So really, lifestyle, we're going to just say what lifestyle is. What is lifestyle? Lifestyle is just how we live our lives, from waking up in the morning to going to bed at night, to picking our goals, to achieving them, to our choices, just the career we choose, just what we decide to do with our lives is just lifestyle. And then what's chronic illness? Chronic illness is something that has been long-standing. Illness is something that you need help with and you have to see a doctor or you need intervention for. So really and truly, preventive, what's preventive? It's just making sure you don't get the disease as well. And I know that some of us might have chronic illnesses and some of us might not have any. But whichever side of the box or whatever side of the line you're on, it's absolutely fine. We all have work to do. So if you're one of those people that have chronic illnesses, the most important thing is to choose to make a positive change today and to choose to be consistent with that change. And you can, trust me, see a reversal of your chronic illness. When I was in medical school, say maybe 16 years ago, they used to tell us that when you have hypertension, you would have it for life. Or when you have diabetes, you have it for life. But in the last 15 years, 20 years, we've seen a lot of interventions. We've seen things change. You can reverse the course, is what I'm trying to say. And if you do not have a chronic illness and you're on the other side, we still have work to do. We have to continue to do all the right things, continue to put in those positive changes, and we will see, the prevention happen. And, very specifically to the Afro-Caribbean population as well, we do know that we are at an increased risk for chronic illnesses. And, it's not surprising why. First of all, most of us are migrants. And when you migrate to a different country, it's a lot of hard work. You have to work extra. Sometimes you still have to look after people at home, which puts a lot of pressure on your body, on your health. Sometimes, just culture change. You come to a different place, but you don't really change your mindset. You don't change the way you eat, and things just don't roll like it's supposed to roll, So at least we've had a bit of an introduction as to what all of those terms mean. So I'm just going to dive right into the different kinds of chronic illnesses. So if we can just quickly just pop in the chat box, what chronic illnesses that we know. Let everyone just put something. If you know one chronic illness, just shout it. Just write it for me. If we don't write it, I'm not going to move forward. So write a chronic illness for me so that we can all participate and have fun with this. Just one chronic illness that you know. Come on, guys, type it in. All right, I can see 4 messages. Yeah, so everyone's just typing diabetes. Very good. There's more than diabetes. Come on, one more. There's cancer. There's chronic fatigue. Yes. What else? High blood pressure. Thank you very much. I think that's really good. That's enough now. Well done. So I put here that my goal today is to really and truly just attempt to increase an awareness of things that we already are aware of. I'm not going to say anything that you've never heard before. And also to just provide tips on how, we can begin to adapt all of these lifestyle measures and keep doing what we're already doing, because I'm sure loads of us are already doing all the right things. So yeah, so this is the list. So there is obesity. I put that at the top of the list because a lot of people don't consider obesity as a chronic illness. It's just part of how we are, but it is a chronic illness. Hypertension is high blood pressure. Diabetes is high sugar levels, heart disease. Osteoarthritis is having pains in your joints and having your joints erode. Gout is when you have really severe pains in your joints as well because of crystals that stay there. Cancer, erectile dysfunction, depression, and the list is endless, etc. So we're going to go into all of, all of the nitty gritty. I just don't want to bore you with loads of clinical and, medical stuff. I think we hear that enough, but I feel like for most people, I've had patients tell me, I was just told that I'm diabetic a month ago, but nobody's told me what to eat. Nobody's told me what to do. We don't get to, because if you have a consultation with your GP, I'm sure you have only 10 minutes. When it's 12 minutes, they're asking you, could you book another one? So there isn't the luxury of time to actually, just break all of these things down. So people become diabetic and they have like really no information, and they carry on doing what they do. They have high blood pressure, you get shoved medication, you carry on doing what you do. So hopefully today we can learn and know that we don't have to continue to climb that ladder of illness. So you can see some people started off with 1 tablet of high blood pressure, 5 milligram dose, for example. In like 4 or 5 years, they're on 2 because they've maxed out the highest dose on 1 tablet. And like in another 10 years, they're on 3. Ideally, what I would love to see sincerely is for you to start on 1 tablet and go down that ladder and eventually not need to take it. But that takes a lot of work, and it is possible. It is very possible. So we're just going to look at some common misconceptions. Okay, I have this slide here. See, right? Slides are really good. Oh, you forget what you want to say. So, before we can actually begin to talk about what to do, what not to do, I feel like there's a lot of internal work that we have to do personally as individuals, in the Afro-Caribbean community. There's an internal work that we have to do. First of all, we have to develop a healthy mindset. It's so important. We have to develop a healthy mindset. We cannot start this journey thinking the way we used to think. We must be open to learn new things. The second one is that we have to be very patient with ourselves. I remember an elderly gentleman telling me that he used to eat a packet of digestives at once for lunch because he was working. Okay, and so now over the years, 10 years, 20 years, 30 years in some cases, you're now very obese and you just suddenly want to lose all of that belly fat in a month. It's impossible. But trust me, every day you make the right choice, every day you make a change, you are heading in the opposite direction. And even it might not be naturally, obviously obvious, but you will feel the difference in your mind, in the way you sleep, in the way your ability to move around. So it's very essential that we are patient with ourselves. It takes time to develop a good lifestyle habit. Give yourself time. Give yourself forever. Take your time. And another thing is that we have to be consistent. We must be consistent. You cannot dip in and out of it. You can't do it for a month. You can't give yourself 6 months. You can't give yourself 1 year. You have to have a mindset of forever. This is what I want to do for the rest of my life. And you would see changes, and you would not be under pressure, and you would not fail because there isn't any over heightened expectations. And then also we have to stay focused on our journey. This is a journey. It is a long-standing journey. Every day will be different, but the more you put in the effort, you would see changes. And like Carol said before, we have to be willing to learn new things. So we're going to look at common misconceptions. Common misconceptions. So I still have a bit of time. Okay. So another quick interaction again. So I want us to put in the chat box what common misconceptions we have about our health. So let everyone just type, yeah, some people answered prostate cancer, yes, stroke, yes, very good. So just keep going. What common misconceptions do you have about chronic illnesses, about preventing them, and about health generally? So just pop that in the chat box. And then let's see, so that I can share what I have put down here, and then we can also rub mine. So what common misconceptions do we have? That we have always been big in my family. You are amazing. That's on my list. That's so true. You would see people you would want to, somebody said, only fat people get high cholesterol. Thank you so much. That's so true. So true. I'm just going to write that down so that I can talk about it. Can I grab that pen, please? Oh yeah, it's over here. Yeah, so like only slim people get, only fat people get high cholesterol. What else? More, please. Carbohydrate food gives us strength and power. Very true. That's so true. So please, more. I'm enjoying this. Please, more carbs give us strength and power. That we are too obsessed with genetics, we sometimes, which sometimes let people down. Of course, genetics is important, but still, there are ways to manage how we live and get around it as best as we can. True. The skinnier you are, the healthier you are. That's such a misconception. I've seen the first time I saw, maybe not the first time, but I saw somebody, I was doing a rotation in accident and emergency in Wigan, actually. That's probably like 8 years ago. And I saw a 45-year-old woman die, Caucasian lady, and she was so skinny. Like, it scared me, like to just see somebody so beautiful not breathing. So yes, the skinnier you are, not so true, the healthier you are. That's a really good one. So skinny does not equate to health. And then sugar is the only cause of diabetes. So true. It is a major cause, but it's not the only cause. So true. Fat is good for African women. They seem to tell us that. They seem to tell us that we like them like that. That's so not true. Okay, very good. Thank you, guys. That's amazing. So what I have here, it says that chronic illness can never be cured. I wrote that here, that chronic illness can never be cured. That's such a misconception. Like I said before, we can reverse the cause. We can reverse the course. We can reverse the course. I know we don't hear that very often, but I have a lot of patients that would say I'm diabetic on diet only, diet controlled diabetes. I have seen people drop their insulin levels because they decided to eat properly. They started exercising. It's amazing the things that food, good, healthy food can do for us. I also put here that medicine is the only way. When we start to treat patients, we tell them that you have 3 months to try and manage your high blood pressure with lifestyle. And if you can't, then we're going to stick you on the medication. But in most cases, though, because we're rushing and people probably don't have the energy for lifestyle, they usually opt out and they just say, just give me the medication. But lifestyle, medicine is not the only way. Lifestyle is another way. And yeah, like what my Aisha said, she said that I'm fat because everyone in my family is fat. That's the biggest lie of the devil. It's a big lie. That's so not true. And then you have to go to the gym to exercise. It says you have to go to the gym to exercise. That's such a lie as well. Like, and I feel like it takes the pressure, it puts pressure on people because not everyone's got the time to go to the gym. Not everyone's got the resources to go to the gym. Not everyone feels comfortable in the gym. You don't need the gym to exercise. All you need is focus and determination, and you can exercise in your house and burn calories, and you don't need to do anything over the top. So we're going to talk about that a bit more. And another thing that I like is that education has nothing to do with living healthy. I know a lot of doctors that are obese. I know a lot of high profile people that are obese, that smoke, it's more like a mindset thing. It's more like a light bulb thing, and really what you choose to do and what you don't want to do. And then also that you must give up everything you like when you're trying to live a healthy lifestyle. Like, that's so not true. I know a lot of some people that would tell me, I have a friend that said she doesn't eat rice anymore. And like, that's so good for you. But I love my rice. So I would rather eat rice once a week than just chuck it. So we don't have to give up everything that we like. We can still eat everything in moderation. Some things we have to give up, but not everything. The things we enjoy, we can continue to enjoy. So I think, do I still have time? I have 6 more minutes. I think the only thing I want to talk about now is the other section, the practical tips. So if we have questions, we can start to ask questions. If we have things that we want to share, Aisha, over to you.
Thank you so much. That was an absolute whirlwind of information.
Yeah.
That was fantastic. Thank you. And I think it's so great how interactive people have been already. So if we keep the momentum going, we have a GP who has a bias towards lifestyle changes rather than medicinal treatment. So I'm sure there are questions. I'm sure there are things that you would like to get some advice about. I know I've got a couple, but I would love to open it up to the floor. If you don't feel like speaking, please send a message to us. But if we have 24 participants, I'm sure there is at least one question here for Izzy on lifestyle changes, either to deal with the misconceptions or anything like that. Hello, can I see some hands up? Looking down the side. Ooh. Right, okay. What I'll do is I'll kick it off with my question while people are still thinking about what they would like to know. Now, when it comes to preventative measures, I feel as though the main challenge that people have is sort of like the mindset. Literally the mindset to decide, I'm going to make this change. I don't know if you have any advice at all in terms of what is it that you found to be most effective in terms of motivating people from our community to make those changes, and the people that you've met who have made the changes. Is there a consistent thread of what encourages them or gets them moving in the right direction?
Sorry, I just muted myself. Thank you so much. I think it's a real struggle because people are in a very difficult situation sometimes, and that's the reality of the world that we live in. So you have people who are probably doing 2 jobs. You have people who have never, done healthy living before. You have people who have jobs that are very solitary. They don't move around. You have people who don't have the resources to even probably be able to buy. Vegetables are very expensive, and that's a fact. So there are a lot of limiting circumstances. Well, I feel like limits will always be there. There's always going to be limitations. And for most people that I have met, I think it's when they hit like a really difficult spot in their life. So they probably had a stroke, or they had maybe a heart attack, or maybe they had cancer, or just like a health problem that really got them to the point of like their eyes opening and a light bulb
Right.
for them. So
Be a sledgehammer.
exactly, for most people, or they have like me now, I'm always on my father's case. I'm always hassling him because, or they have someone really close to them that just puts them under pressure and saying, you must do the right thing. If you're not going to go, I'm going to pay for you. I'm going to get you the food. I'm going to get you everything you need. Somebody who is always on their case. But other than that, I feel like we need more education on actually eating properly, living properly, having less stress, doing all the right things. It is difficult, to be fair. It is really difficult because people have real challenges. And to be honest, if you're under a lot of pressure, I think healthy living is a list of your problems. And people have so many things to juggle that they don't think that's on their list. But the more things you have to juggle, the more healthy you should actually live, because all of that will come into a culmination and cause even more stressful for your body.
Education is definitely key, and I think if you've got people like you who are making the information accessible and not so scary sounding, because I know when I've tried to encourage my siblings to do things like exercise and whatnot, they see me and they're thinking, no, we're not going to do any of that. If I say, oh, come, let's do an exercise session together, it's a thing where they can be confronted like with something like that, and it's a bit too much. I've noticed that when I've consistently showed up and pushed them, eventually a couple of them start to crack. So it can be done. Femi, did you have your hand up before? I saw a thumbs up or a hand up before.
Yeah, I have a question. Thank you very much for what you've been talking about, Dr. Izzy. Very, very eye-opening, and some, I would say, they are sort of reassuring. My question is this. I don't know if I'll put it as a question, but or rather something that I would want you to say more about. It's about early discovery of any of this chronic ailment or chronic illness. One of the things that I think is prevalent in our community is the fact that these things get to the very extreme before they are discovered. And it's sometimes based on mindsets like you just don't think this thing can happen to you, and then you just live your life in a way. So I don't know, what advice would you give to us in terms of early discovery, or checking oneself and all that? Thank you.
Thank you very much, Femi. That's a really beautiful question. And that, like I said before, like it's Afro-Caribbean community. Most of us are Christians, and so we're very spiritual people. So I would hear patients say things like, it's not me, blood of Jesus, and all of those kind of things, which the blood of Jesus will always cover us. But, the Bible says very clearly that we should be wise as serpents. I feel like living in England is such a blessing, because they would send you out letters for, for tests and ask you to come and, check for screening and all of those things. But a lot of people don't take advantage of it. A lot of people don't do it. A lot of people just don't have the time to even go. Some of them just don't even remember, or they feel too scared to want to go. Some people don't check their blood pressure. Some people don't, because I feel like if you ignore these things, you are obviously waiting for it to start to happen. So if you're just passively ignoring it, then that's mean you want it to happen. So we should be checking our blood pressures regularly. Most surgeries now just have like a mobile blood pressure check. So you don't even need to book an appointment. You just walk in, and in the reception, you can just stick your hand into one of their fancy equipment and you get your blood pressure checked. It's a small slip you take it. You can just do it every month. You can buy one of the small kits, which I think is so essential now, and just regularly know what your blood pressure is, so that even when it starts to creep up, you can identify the signs. And imagine it creeps up 5, 5, 10, 10, and you begin to do something then, as compared to when it's bursting your veins and it's like 180 over 120. So your chances are less. Then you're going to be given so many medications because you're a step next to having a stroke. So like Femi is so right. We don't check ourselves enough. We have to check our blood pressure like every week, every month. It's not too much. If you get a screening letter, please get screened. If you find a lump in your breast, please don't blood of Jesus it. Go and check it. Once you pray, you ask the blood of Jesus to remove it, and then you go and see your doctor. If you see blood in your stool anywhere, if you are losing weight, whatever it is that you find, make sure you seek help. Go on your knees and pray. And a combination of all of that, and you see a miracle. So the earlier we get on top of these things, the better. And, the less devastating it will be. Thank you very much, Femi. I hope that answered your question.
Yeah. Okay. Yeah. Aisha, can I ask a question if that's answered?
Absolutely, go for it.
Okay. Yeah. Just combination of questions and all that and issues together. Now, I know this is common among the Caribbean and Africans, like we don't report things. I know you've talked about that. Is there a way to, because like you're having a headache, fortunately I work in this country like a lot of us do, and you see that your mates or your colleagues and all that, a little cough, a little headache, and they're not coming to work, they're calling off sick. But I think we kind of leave it, and we have headache. In fact, the thing that will make an African person say call off sick, if you are not skiving, you must be really very sick. So what are some of those? How can we be encouraged? What can you tell us on this forum so that we don't say, oh, it's just a headache, I will still go to work, or it's just a common cold and things like that. That's number one. And then number two, another thing is like, one of the things you have said that we should not passively ignore things. And you have also said that food can reverse, or diet or lifestyle, the way you call it, can reverse some of these issues that we find. But a lot of people find it difficult to adapt to new diets. It's like, some people even feel that if they adapt, it's going to kill them. I've heard that before. And there's one, I've been eating pounded yam since I was born, from my mother's womb. How, changing is enough to kill me. How do I make that happen? So I don't know if these are questions, but if you could just kind of encourage us or throw more light on this. Thank you.
Thank you very much, Anthony. That's a really very lovely, funny question. So the first one, you said, what do you do when you have a symptom? I feel like, it's a challenge, because a lot of Afro-Caribbean people are very naive, very shy. So you would see a patient come into the clinic space and, they're very excited to see me because I'm brown skin colored, and then you can see a different air around them, because they feel like I understand what they're saying. Some of them don't communicate very clearly. Like, I think you need to own you, because at the end of the day, you need to be courageous. Like, it is you are here, you are standing here, say exactly what you want, and you will get, because the more confidence you have in yourself, that's what you're going to portray. So I feel like a lot of us are not very confident. I think that's what I'm saying. So please let us be confident. If you walk into a doctor's office, it is the doctor's right, regardless of who you are, whether you speak English clearly, you don't speak English, as long as you can communicate what you want, it is your right to get that help. So if you have a headache, for example, like Bumi said, please go and see your doctor. I would rather you come in and they get you checked out and they say, there is nothing wrong with you. Come back again if it happens, than you don't show up because you don't want to disturb anybody. I have a lot of people say, oh, I don't want to bother them. Please bother us. We want to be bothered. That's what we are there for. Because if that slot is empty, we're going to be drinking tea in at the time when we're supposed to be working. So we need to be bothered. And a lot of people just suffer in silence because of the culture. It's I'm from Nigeria, and in Nigeria it's oh, I don't want to bother you, it's okay, I'll be fine. We die in silence. Like, that's not even allowed. Like, that's one thing I've learned in England. Like, you must open your mouth and speak, say exactly what it is, and just communicate clearly and with confidence. They're not going to eat you. Like, that's their job. That's what they are there for. I hope that helped. And then she talked about adapting to a new diet. I think that's a lifelong struggle. We are creatures of what's the word? When you're used to doing something that so we just
habit.
Yes, we're creatures of habits. We do the same thing today, tomorrow, and before you know what's happening, it's 20 years, it's 30 years, but we just do the same thing. Some people have really nice appetite for different things. Some people just stick to what they know, but I think that is the mindset change that we have to start to work on. We have to be open to try new things. I was thinking of it the other day. The first time I ever ate cucumber, the first time ever in my life, I'm almost 40 years old, and the first time I ever ate cucumber was 2017. So I was over 30 before I ever tasted cucumber. And I said to myself, why did this happen? Because this is such a nourishing vegetable or fruit. It's so nice. It's good for your body. Why haven't I eaten it? Because my mother never brought it home. Because bless her, she probably doesn't know what cucumber is. Or bless her, she doesn't even know that it's good for you. But inside all of that, you come here and you have a chance to, come in contact with a new way of eating. I think we should be opened. And there are different ways to eat things that we don't like. I personally, if it's good for me, my taste buds is going to have to like it. Like, that's how desperate I am to live healthy. If it's good for me, taste buds, come and like it. And then also, we have ways, we can teach you ways on how you can try different things in different ways that will be very palatable to your palate, and it won't be as bad, and over time you will begin to learn these things. And then also, I think we should take responsibility for some things as well. So YouTube is your best friend. Google is your best friend. My husband always says, let us look at how people cook different kinds of food. One might just, you might just like one and you can try it. If it doesn't work out for you, move on to the next vegetable. But we need to be open to change. We need to be open to try different things. And I would rather eat a vegetable that I don't like than swallow amlodipine 5 milligrams, which is a hypertension medication. Or better still, I would rather eat something I don't like and I know it's going to prevent me from having to take injection insulin. So I think it's the devil or the deep blue sea. Choose one. No, I think it's not that bad. It's really not really the devil. Maybe like, maybe like a really scary angel and the deep blue sea. But really and truly, I think we still have to give something up. We can't, not in this age, we can't be popping sugar stuff and expect to be healthy living. It's not going to work. I hope
Thank you so much. I think that's been, Thank you so much for that response, because I think that answer was quite thorough. I've gotten a lot from it already. I've got one question in the chat, but I think Tolu has got his hand up for a question for you. I could ask you to unmute and go for it.
Yeah, thank you very much. Thank you, doctor. You mentioned that as a patient, you've got a right to demand for treatment, etc. I think, yes, you do have the right, but I think, again, it depends on the area you live in. If you live in a predominantly white area, you will suffer the health inequalities. I give myself an example. I live in a very white area in Stockport, Cheshire, and I have high blood pressure and cholesterol. Well, I had cholesterol first, and then I was diagnosed to have high blood pressure, and I was prescribed statin medication.
Yeah.
And I question everything, being a typical Nigerian. Even if you give me paracetamol, I'll have to read about it before I swallow it.
That's very good.
Yeah, and when I did my research, and I always research the American, site rather than the British site, because everything British goes under the national health. If it's not NHS, signed off, they won't approve it. So anyway, I researched and I found out that statin reacts to other medication. And when I spoke to my GP, I was made to sign a form to say I refuse to accept medication. In fact, I was threatened. I was going to kicked out of my surgery. I was going to be what was it, well, cancelled or whatever from my surgery. And what happened 2 years down the line? I suffered paralysis from my neck to my toes. I had a reaction from statin with my medication. And I was lucky to be alive. In fact, they sent me home to go and die. Which caused me inflammation of my liver, and they had to send my blood test to Oxford from Cheshire to Oxford because they couldn't find exactly what was wrong with me, only to find out I was reacting from statin. Now, why you say you've got a right to challenge that? The system failed me because I didn't have a right to challenge that. Instead, I was threatened. Now, so again, I mean, like, what is any way we can go around that issue about knowing your right and at the same time making sure you stick within your right and not offend the so-called NHS, because to be honest, it's a white privilege profession.
Yeah, thank you very much. What can I call you? Is it Tolu?
Tolu.
Yeah,
Tolu.
Thank you for your question, Tolu. That's a really strong point, and that's a very valid point. I feel like sometimes you are fighting against the system, and that's a fact. Even in my own personal life, and I'm really sorry that had to happen to you. But from the back view, so from a doctor's perspective, that could have happened to anybody. So I don't think that happened to you because you were Afro-Caribbean. I've had similar situations happen to white people. There is sometimes a flaw in the system. Sometimes people are negligent. Sometimes people don't do their jobs very well. And that's something that's always going to happen. And that's not because you're Afro-Caribbean. But what I would say is, and that's why such forums like this are really, they're powerful. Don't take it for granted, because if you send a message to me, send it to Antibami and say, can you please ask that doctor this question? I would answer you. Like, it's a privilege that, I have the benefit to be sat in this position, and I would answer you. You don't take any medication that you're not sure of. Just always come from a polite place. So you know how the Bible says that don't be, an angry tone would increase your anger. I'm just paraphrasing. Like, when people start to get defensive and aggressive, because you obviously need the help, you need to like put your voice down and let them know that you need the help. You're willing to listen, but all you're just trying to make sure is that you're getting the best care. No one should be threatening to get you off the surgery list if you were not violent. That's usually the only reason why one will go on to kick you out, And sometimes, even with the statins, some people don't want to take it, but some people would take it. It's beneficial for preventing stroke and heart attacks. But I feel like, the way we approach things generally, because, I'm sure this was probably a long, continuous situation for you. But really, if I was going to be seeing a doctor and I wasn't sure, I would probably say something like, I have a sister who is a GP. It always works. So, and I've spoken to her, and she thinks this, or he thinks that, or I think it gets them a bit, like, they listen better. I'll give an example. A while ago, a very close family member was diagnosed with hypertension, and this very lovely elderly white Caucasian doctor gave him medication that I know was going to cause erectile dysfunction in another 5-10 years. And I said to, this family member that this is a wrong medication. First of all, this is not in the guideline. This is not the first step in this treatment. So go back and tell him that your family member said, who is a GP, said that this is the wrong medication. And he went back and they fobbed him off, la, 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 la. Very classic story. It does happen. And, I said, go back again and say to them clearly that this is what you want to take because this is what your family member GP is asking you to take. And I'm sure we don't all have those privileges, but with forums like this, we can continue to build our strengths, we can continue to build our knowledge, we can continue to build information. And, eventually he gave the right medication and apologized, So I think sometimes we don't have to come from an aggressive place if people are not being aggressive, because I feel like two wrongs never make it right. So if someone is being aggressive and defensive, so we have to come from a place of, peace and just trying to explain our position. So like I said, I'm really sorry you had to go through that, and I hope you recover well. But yes, we don't have to die in silence or, and I don't feel like having to drag surgeries or doctors to like all of these ombudsmen people is probably a good idea, because it is stressful for you, it's stressful for them. And then they tell the other surgeries that this person is a troublemaker, and it just makes your life really difficult. But I would say if you don't feel comfortable with any medication, please challenge it in the most peaceable way that you can. I hope that helps.
Yeah. I mean, like I wasn't being aggressive when I spoke.
I'm sure you weren't.
I used to be a police officer for 13 years, so I know how to face aggression with with non-aggression. So I'm trained in that way, and I wasn't aggressive. But it was just the fact that I challenged the reason why they're giving me the medication.
Yeah.
When they can react, and they don't like people being intelligent. They just said, if you refuse to take it, you have to sign a disclaimer. Blah blah blah.
And maybe at that point, what you could have done was to leave the surgery really, and just say, you know what, can I see another doctor? Because you just say, can I see another doctor, and just ask to see another doctor, which is usually very okay. So just say, you know what, Mr. James, I'm really sorry. I don't feel like we're communicating here. I don't feel like I'm getting my message across. I really need your help, and I'm worried about this medication. Would you like me to come back next week when you've had time to go and have a look? Or would you like me to see somebody else? Because I don't feel comfortable talking about this subject with you. Like, it's your right to say that. If you're not comfortable with that doctor, just ask to see another one. Yeah. Rather than, begin to go back and forth with one person. Some people are just sent from hell. You don't want to have any business with them. And it's not because you're Afro-Caribbean. They'll treat everybody else the same way. So it's better you just say, no, devil, not today, and go somewhere else than continue to fight with them.
All right. Thank you. Thank you for that.
No worries.
Thank you.
Thank you so much. Wow. That has been intense. That has been intense. I'm so sorry that happened to you, Tolu. I just had to mention it again. To keep the program moving, we're going to move to the next section where she'll be sharing some practical tips as to how we can implement lifestyle changes that will be beneficial for us and hopefully help us avoid chronic illnesses. And then we can move on to a couple more questions that I've received in the chat space. So thank you so much for your time so far, and I'll pass on over to you, Doctor.
Okay, thank you again. So we're just going to move on to the practical tips on how we can actually bring to life all of these lifestyle changes that can actually make a difference to our lives. So again, we're going to be very interactive and just pop in the chat box what lifestyle change we think we need to stop or we need to start. So what do we need to do? So comments, please. Comments.
Feel free to unmute yourself and say something out as well if you don't feel like typing. It'd be great to hear answers. What do you think?
Hi, did you say I could ask my question?
Yes, thank you very much. So somebody's saying eat more fruits. Somebody's saying eat more vegetables. That's a lifestyle change. Very good. So that's just one. So that's one wrapped in that's two answers wrapped in one. So can we have more? So that's just one. Sleep. Thank you very much. Thank you, Tolu. That's amazing. I don't think people remember that sleep. Exercise, beautiful. See how excited I'm getting. So 3, more. Come on, guys. 3. Play. There, that's like relaxing. Good. Play is always a good idea. Supplement pounded yam with cabbage swallow. Very good. You see, I'm talking to my people here. Well done. Reduce stress. Go on holiday if you can afford it. Yes. Laugh. Beautiful. Drink a lot of water. That's amazing. Limit processed foods. Beautiful. Thank you guys. You guys are super. You guys are the best group ever. Yes. So yes, I've got my little list here. And yes, so this is inexhaustible, but this is just what I put down. So smoking, alcohol, exercise, sleep, drinking water, stress, and eating your cabbage swallow, and eating fruits and eating vegetables. Very good. Very, very good. So we're just going to start to debunk some of these tips and just, you know, add some of the tips that I've learned in my own personal lives over the years and in practice over the years. I've seen things work, and just hopefully we can learn a few things. So smoking, I'm not going to dwell too much on it. I think the only thing I have to say is just please stop. I don't think there's any way around that. Please stop smoking. There's just nothing else to say. Get help. When you go to the surgeries, there are different helps that they can give you: patches, tablets, counseling. There's so many other things. Like smoking would increase your risk of chronic illnesses. It would cause cancer. It would cause diabetes. It would cause hypertension. It will make you fat. It will cause everything. You know, it will make you anxious. It causes everything. So please stop smoking. Alcohol. Alcohol in moderation. In moderation. So not every now and again. I'm not saying just stop. But just bear in mind that alcohol is empty calories. It's very high in calories. It causes anxiety, steals your sleep, you know, and doesn't make your skin pop. So I don't know why anyone would want to be drinking. So yes, alcohol in moderation. And then the next one is exercise. Exercise is a must. Like, it isn't something that I feel like, I don't feel like. I think it's the logarithm of where you are. So from 0 to 10, you can be on the scale of 1 or on the scale of 10, but you must exercise. You need to find what you like, what you enjoy, what you can be consistent at. And I know that we talked about at the beginning how we needed to stay focused. Exercise is one of those things. I don't like walking for 2-3 hours. I like going to the gym for 45 minutes and killing myself, and that's it, I'm done. Some people love to walk. They're happy to walk for 4 hours. If that's your thing, very good. Some people can only walk for 10 minutes. If that's your thing, very good. Some people can do pushing up against the wall. If that's your thing, very good. Some people can take their bottled water, that's my bottled water, and lift it up 10 times on the other side. If that's your thing, very good. As long as you're doing something that's consistent, as long as you're raising your heart rate, as long as you are, you know, working out not every day, every other day, just find a routine. If it's twice a week, 3 times a week, 4 times a week, 5 times a week, as long as you're doing something. There's so many. And one of the best ways to exercise, I'm sure we've heard all of this before, you know, is probably get a job that's active. I had a patient once, a white Caucasian man. He came in and said, I didn't recognize him. And I was like, Dr. Izzy, don't you remember me? I was like, could you try again? And he was like, oh, I was this guy. I was like, oh, wow, you've lost so much weight. He was like, yes. So what did you do? He was like, he changed his jobs. I was like, sorry, what does that mean? He said he had a desk job and was putting so much weight on. And then he decided to become a postman. So he said he wanted to be on the road. He was dropping posts. And this gentleman lost a lot of weight. So we can make choices with our jobs rather than just sitting in one place. We can have more active jobs. And then also, you know, we can also aim to work everywhere. Like if you're going to the store, go to the store, especially for like elderly people that have children and they can ask to do stuff for them. Rather than send your son to Tesco, you go to Tesco. And that's 20 minutes. You know, you've put in the work that day. And another tip that I really find helpful, because I feel like walking is the quickest thing that most people can do. It's free, there's the roads, you know, it's fresh air, it clears your head. You know, get a counter. A lot of our phones now are smartphones. They have step counters in them. Some people have this really nice band that you can get for 15, 20 pounds. If you have a step counter, it gives you a target. So if you say you're going to walk 3,000 steps every day, and in 2019 you walked 3,000 steps every day, that's progress. If you say you want to walk 10,000 steps every day, and you know, in a month you manage to do 10 days, 20 days in a month, that's beautiful. But if you haven't set a target for yourself, you don't know if you're doing any better. You don't know if you are making progress. And with everything, you must set a target. You can't just do it out of, you know, out in the deep blue sky and just whatever happens, I'll just do something. So if we're choosing to walk, please let us get a step counter or use your phone. Make sure you know how many steps you are walking every day. And obviously, if you're able to hit the gym, keep going, you know, it's really good. I'll just remind us of the benefits of exercising. When we exercise, we help our heart to endure. You know, our heart health is better. You will feel fitter. You know, if you had problems with your breathing, you would breathe better. You would release feel good hormones. Some of us just needs to be happy. And when you exercise, you feel so much better. You're just nicer to everyone afterwards because all of the endorphins have come up. You know, you just so you feel so good with yourself. You feel like you're on a high, and that's a fact, and it's so nice. And then you would sleep like a baby. Like that's a promise. You exercise, you would sleep like a baby. And who doesn't want to sleep like a baby? I'm sure we all want to sleep like a baby. So exercise is amazing. The next one is sleep. You know, I feel like sleep is such a massive thing, and a lot of people just forget that sleep is so big. I did like a semi study once, and I had a very close family member who we were on the same diet, and we were eating the same. But I'm a night shift worker. I do night shifts, so I work from midnight till 8 o'clock, and I love it. And we ate the same kind of food, but he was losing weight, and I wasn't losing anything. It was so annoying. It was so frustrating. So I went back to the drawing board, and I was like, what did I do wrong? Like, what have I not done right here? And I realized that while he goes off to bed to sleep, I'm off to work. And when you're not sleeping, your cortisol level, which is your stress hormone, is off the roof, it's off the chart. You haven't slept. So your cortisol is high, it would stimulate everything. Your appetite goes off. You want to eat everything that your eyes are seeing. Vegetables are no longer interesting anymore. Your stress levels go up. Your insulin goes off the hook as well. You are more likely to gain weight when you don't sleep. If we're not sleeping, we will gain weight. And, you know, especially for people who do shift work, you know, you need to look after yourself. There's so many studies about how people who don't sleep at night have a higher risk of chronic illness and cancer. And that's really scary. You know, so we need to keep our eyes on our sleep. Sleep is good for you. It is good for you. You need to sleep your hours. You need to make sure that you wake up feeling rested. You know, it would regulate your appetite. It would help you enjoy your vegetables when you eat it. You would lose weight when you sleep. If you wanna try it, because I feel like trying is believing. I don't know if that's the word, but when you try some things and you actually see it, you believe it. Every time I come off a night shift, I put on like 0.8 kilograms, and every time I sleep at home, I lose a kg. And I'm doing the same thing. Like, I'm not doing anything different. The only difference is that I slept on my bed, and it's just amazing. Like, I didn't realize it was that intense. You would put weight on when you don't sleep. So we need to sleep because it would help our mood and it reduce our anxiety. So the next one is drinking water. So if I say to us now, how much water do you drink every day? I just want people to pop in the chat box as well, because this is something that people would just say, I drink water. But if you cannot tell me how much liters you drink every day, you don't drink water. So everyone just want to tell me how much water they drink? A couple of people would do, just 2, 3, 4 people, 2 liters. Very good. Who else? How much water do you drink? How much water do you drink? 1.5 liters. Okay, that's not enough, Aisha too. How much water do you drink? So if you see people who drink water, they always have a bottle next to them, not a glass, because anyone can sip up that glass. Because my home, my family, they know if they touch this bottle.
Yes, I have.
Very good, very good. You know, you must have your bottle. Like, it's an investment that is so beneficial. 1.5 liters, Val says, so that's not really a lot. So you can see that we don't drink. We need to drink. As much as I don't feel thirsty, thirst is a sign of it for me. I can't exceed it. 4 liters, well done, CC. So yeah, we need to drink up to 3 to 4 liters. And the best way to know what to drink is to multiply your body weight by 30, so by 1 ounce. So whatever you weigh, so if, for example, if you weigh 70 kilograms, multiply your body weight by 10, multiply your body weight by 30. That's 2,100 milliliters. That's the minimum that you should drink, but you can drink more than that. So that's why the amount of water I drink is not the amount of water you drink. We all drink different volumes, but we need to drink. So to know your minimum amount of water, I'll say that again, multiply your body weight in kilograms by 30. And that's your minimum amount of fluid every day. Water is amazing. It will rinse, it will clean your kidneys. It will make you less hungry. You will feel hydrated. Your skin will shine. You will feel less tired. It's just amazing. We need to drink. So I think one of the things we need to take away is that if you do not have a bottle that you carry around, please invest in one. It's a very good idea. The next thing is, how did this get here? My vegetable soup. The next thing is stress. Stress is another big factor. Like stress is so big. Like stress, you know, like we Afro-Caribbean people, we've got family that we're looking after at home. You know, we're paying for this person's school fees. We have money problems. And that's why it's so big. We need to get our money right, because if you're broke, you're going to be stressed. I don't care how stress-proof you are. If you're stressing over money, you would be very, very stressed. So, you know, we need to be content with the life that God has given us so that we can minimize our stress levels. Some people are very anxious. Some people are very depressed. And it's just a roller coaster. It rolls into another phase of your life. And when you're stressed, all of your stress hormones are high. I talked about cortisol before. When you're stressed, your cortisol levels go up and it just triggers everything that goes wrong. Your insulin, you become resistant to insulin and you start gaining weight. So truly, yes, we need to find ways to minimize our stress. And then the big elephant in the room, all of the cabbage swallow people, eating healthy. So eating healthy is such a big thing. I left this till the end because I feel like this is where we all struggle. And this is where we all like really, really struggle. So, you know, if you are going back and forth on a diet, if you are losing weight and adding weight, you know, you need help. And that's a fact. Like, we all need help. We all have the Holy Spirit that helps us. You can see all of these amazing people who do amazing sports. They have coaches. There's a reason why they don't exercise themselves. There's a reason why they need somebody to kick them on the backside and say, you can do this. There's a reason why you need a cheerleader. There's a reason why you need someone to continue to monitor what you're doing. Because the fact that someone's checking up on me would probably help me to do better by 30%. Especially if no one was watching me, I'll pop that chocolate in my mouth. And the more positive choices that we make, the better we will get. And I was just going to say, if your belly size is bigger than your hips, so if your waist region is bigger than your hips, then we're in serious trouble. Like, it means that 100%, we need to take this just more than an afternoon lecture. We need to like seriously focus on making lifestyle changes. And like I said before, you cannot try healthy eating for 2 weeks and give up. I've been doing this for 7 years, guys, 7 years, and I'm still learning. Like every day, like I actively started to learn how to eat properly 7 years ago. And every day I'm learning new things and just getting better at it. And we will continue to all learn. One of the major things I want to talk about is the difference between this picture. So they're both, this one is eforiro, which is like vegetable soup. And then this is the same vegetable. So there's something called eating alive and eating dead food. So it's such a big thing and it changed the game for me. So when you eat alive, it means that you're eating raw food. When you eat dead food, it means that you're eating anything cooked. And I don't care if it's vegetable. Whatever has gone on hot water or fire or oil that you've put over a stove, that food, you have killed it. And it's not going to do your body any good or not as much good as compared to eating alive food. When you eat the spinach that is green and raw, it would heal your body. It would heal your body. It's amazing. So people would say, before I came into this country, probably, my idea of vegetable was on the other side. So vegetable soup, that's what I thought was vegetable eating. You know, I remember like almost 10 years ago when I started working in the hospital, I had this colleague of mine her lunch was spinach. She was a white Caucasian girl. Her lunch was spinach and a bagel and something else. And I used to be like, come, is she normal? Like, why would somebody eat a bagel and spinach? I just used to stare at her. I was like, Like, what are you? But meanwhile, I used to have my jollof rice and chicken. Meanwhile,
And
I was the
dodo.
one who was retarded. Like,
And dodo.
I'm the one that had a problem. Like, every afternoon, I ate jollof rice and chicken. Like, every lunch. So while she's eating her bagel and spinach, I'm eating my my jollof rice. You know, so all of those dead food would not do your body any good. So every day, as a matter of I must do, you must eat a portion of raw vegetable. You must eat a portion of raw. I think I've gone over my time, so I'm just going to rush over it now. Sorry. And then our body needs to rest from eating. Our body needs to rest from eating. It's popularly called intermittent fasting. So guys, you know, there's so much more information I can give you. I'm just going to rush through it. When you do that, it cleanses your body. And then we will also learn how to track our food. We must learn how to track our food. Like you're tracking your steps, you must track your food. There's a really lovely app that I use. It's called My Fitness Pal. Download it. It's something very challenging to use, but you know, if you contact me, I can help you walk your way through it. And then giving up processed food. We need to stop eating things in a packet. So we can eat anything that grows from the ground, even if you're going to cook it, but anything that you're opening a packet to, you need to start to have a burial ceremony for those kind of foods. So you can't eat crisps anymore if you didn't make it. I mean, you can make your own crisp, so you can do your own potato and crisp it. But if you're buying it off a shop, like, we can't be doing that, especially when, like I said, our belly is bigger than our hip. That's the problem. And then another thing that a lot of people say is that they eat a lot of fruits in the name of eating fruits and vegetables, and they actually gain weight because you can't just eat a lot of fruit. So there's so much that we can talk about. Yeah, I also put down here using a spray oil bottle rather than using like pouring your oil in. Cook your own food. Plan your meals, guys. If you're working long hours, plan your meals. Have your breakfast, lunch, and dinner packed. If you don't plan your meals, once your blood sugar drops and you're hungry, you would eat anything in front of you. Especially for people who work maybe in a hospital setting, there's always chocolates everywhere, and you would pop it in your mouth if you've not planned your meals. Yes, so I don't know if can I still say this? I was just going to quickly say, what is your why? Like, what is your why? Because it's easy to chat about all of this, but if your why is a health problem, if your why is you want to keep playing with your children, you want to breathe better, you want to be more active, you need to ask yourself what your why is. You know, you need to know what your why is, because I know what my why is, and that's what would prevent me from opening anything in the packet. I'm just going to say a very little story. It's a personal story, but a few years ago, I had a kidney stone because I wasn't drinking a lot of water. And so that's why my life changed and I started drinking water. And then following that, I started to get a lot of urine infections. So I went to the GP and I just said, refer me. And they referred me straight to the urologist, you know, and he had a look in my bladder, gave me antibiotics for 6 months. I still was having urine infections. And, you know, I just one day I had enough. And I said, God, you need to help me. And, you know, I just had this very clear leading in my spirit that it is all of the things that you eat, Izzy, that's making this happen. So I realized that every time I drank a lot of tea, just tea in a tea bag, I would get a urine infection in the next 2 days. If I had chin chin, I used to buy a big box of chin chin and take small upstairs when I'm going to bed. In 2 days, I will have a urine infection. If I had crisp or plantain chips, whatever it was, anything in a packet, it used to irritate my bladder. And I started learning how to stop those things. And when I stopped having a urine infection. So I need you to ask yourself, what is your why? Why do you want to be healthy? For your children, for yourself? You know, just what is your reason? And whatever your reason is, stick to it. And yes, hopefully we would overcome. So I think we're going to move to questions now. And yeah, sorry for spilling over the time, Aisha too.
No, it's quite all right. I think we were quite generous with the time we had with other people sharing their own experiences. So it's all worked out quite nicely for us. Before we move on, I just want to say I'm popping something in the chat space right now, which is the name of Izzy's Lifestyle Holistic Support Facebook group. So you can see the name over there. It's Lifestyle Holistic Support with Izzy. So you'll be able to get more and more of what you've seen today. You'll be able to be part of the community and be able to get people to provide you support, people who have relevant stories relevant to your experiences as well. And that will be like the big difference, you know, in comparison to joining a different type of health support group. And so, and over there, she's also dropped her email address. So if for any reason even in the time that we have today to ask questions, you're not feeling like you want to ask a question, or you just end up thinking of a question later on. Her email address is also in the chat space. You can see it, lifestyleholistic0@gmail.com. So again, feel free to copy and paste that, or write it down. Get in touch. We want our lives we want to be able to thrive. We want to be healthy and well. And so we've got all these resources around us. We're trying to make sure we don't have excuses as to why we're living a life that is subpar. Now, I can see that we've got just over about, I think, a quarter of an hour left in our program. And we did have some questions before. They were sort of like questions / comments, and were a similar vibe. So I'm just going to, I hope they're not offended by this, but I'm just going to sort of like roll it into one. And it was with regards to going to see the GP. Basically, was the main thing. One person touched on sort of like health inequalities and how they can be affected by not trusting that the GP is giving them the best service and is unbiased. But what I would put to you is, how is it, as you're a GP, how can you, what hints or tips can you give us that can help us maximize our 10-15 minutes that we get with a GP? If I was to go there, or as a GP, what is it that you appreciate people doing, coming prepared with to an appointment? If we could have that. And then we've got a question from Ineka, who wanted to ask a question previously. So the question is, how can we best use your time when we come to see you?
Okay, thank you very much. That's a really important question. I used to, when I live in Reading, which is like south of England. And when I started as a GP 5 years ago, I didn't have a lot of jobs in Reading. So I used to work in London. And then I realized that I went to a very dense Afro-Caribbean Asian community, and I never went back there because I was very offended. I feel like our people don't communicate clearly. And that's a problem, because if you come across to me like you're not telling me exactly what you want, and I understand that's part of the culture and how we are, we're a bit timid, but like we really need to break out of all of those restrictions. You can't be timid. Like you need to state very clearly what it is that you want. And then also we should do our research. Like Google is your best friend. Like there's so much resources right now. Before, like, Auntie Bumi, I call her Auntie Bumi. So the coordinator, so I'm still gonna call her Auntie Bumi. She's my auntie, she's my big auntie. So before she goes to see her GP, she grills me like an hour on the phone. Is it this? Is it that? Is it this? What should I say? You know, and maybe we might not have all of those privileges, but we can look online, have a look on the NHS website, you know, just toddle around, have a feel for what you think you have. And like I said, these forums are where we grow our strengths. I'm sure it would take me probably a minute to just quickly type type an answer back to you and just give you a reply. Ask people, ask doctors. If you go to church, you have a doctor in that church, be their friend and say, hello, doctor, please, I need your help. Ask a quick question. You might have a friend that knows a friend, you know, just find out, ask information. I would prefer if someone was sat in front of me. Once a doctor knows that you know what you're talking about, they would behave. And that's a fact. Like, so get your information right. And I'm sure that's not a privilege we all have because of age difference, education difference, social status, whatever that is. But, you know, ask questions. Don't think you don't have the right to ask. Check before you get there. Know what your right is. If you know what your right is, you're able to, you know, ask for it. You're able to demand it. You're able to enjoy your privileges. But if you don't know what you've already been given, you would not be sure. And once they pick up on the fact that, you know, I can walk over this one, you probably be walked over.
Thank you so much. I think that goes far to answer all the points that were mentioned in that vein, because it was a suggestion for us to have easy to read pamphlets that could be given to people so they knew how best to use the GP's time. I think what I've really drawn from what you said is that at least check Google, Yahoo or Bing if you have something against Google. Check a search engine for some advice on what it is that you suspect is going on, and ask whoever is around you for some advice as to whether they have experience with it, and then go to the doctor armed with that information with confidence. I think that is a challenge that I do see with our people, because you want to be polite, and a doctor is seen as an authority figure because they're the people who have the power to diagnose or not. I think that goes far to goes into a much deeper challenge for our community, really. In terms of a practical tip from today, it's get as much information as you can within your own power and go to your doctor with that information armed and ready, so that at least you're not spending any time waffling while you're there and can get direct answers.
That's it. Don't waffle.
So,
be clear, be precise. Exactly.
So Nneka, finally we get to your question. I'm so sorry, you've tried so many times.
No, it's okay. I think my question has been answered. Is regards to the GP, because I had an issue with my daughter, and the GP just said my daughter, and she was 8 at the time, was faking it, and I said I should go back to school. That is school that will refer my daughter to them and things like that. But like Dr. Izzy said, Google is your friend, because I Googled the symptoms, and some parents put on what the vitamins they gave their children, which I bought, and then my daughter is using it, and I can say she's better. So thank you for the information and all. So my question has been answered, really. I wanted to ask a question and then say, truly, you can always go to Google and all. So
thank you.
Thank you.
That is so great. Thank you. I'm glad we were able to finally get to your question. I'll say there's room for one more question before we go into the brief overview and start to wrap up.
Sorry, I think Mary lifted up a hand. Can I just say something quickly before Mary comes on? I saw someone put on the chat saying that when they drink a lot of water, they wee a lot. And that's really good. You know, just cleansing your bladder that way is really good. What I tend to do personally is when I know I'm going to be in the house, I drink loads. So if I'm going to be leaving at, say, 4 p.m., I stop drinking about 2 o'clock so that I would have emptied my bladder before I leave the house. And if you're in the house, what's wrong with going to the toilet all the time? Or even if you're at walk, you know, you're counting your steps exactly when you want to even count your steps. If you're at walk, an excuse to get off your desk as well. So you might as well go to the toilet 10 times to get 10 breaks, you know. So yes, it's no problem if you're at work. It's no problem if you're at home. Obviously, if you're out and about, it might be a real problem. So I just stop drinking like 2 hours before I need to leave so that my bladder is almost empty before I hit the road. I hope that helped. I'm not sure who asked that question.
I've just seen it, but I think that's answered. I've seen something about, what about drinking a lot at night? I wake up to drink water a lot. So I'm wondering if that's been answered by you already. But drinking water at night, is there a particular reason someone would be thirsty at night, especially, as opposed to during the waking hours?
Yeah, I think that's really tricky because I don't like my sleep being disturbed. It bothers me when I have to wake up more than once or twice to go to the toilet. So what I tend to do is make sure I drink well before 8 o'clock so that by 10, 11, my bladder is empty. If you're weeing a lot, if you're thirsty, then you probably need to see your GP and maybe make sure that your sugars are right, because that's how you have, those are one of the symptoms of being diabetic. So just excessive thirst. And sometimes just nocturia, which is nighttime weeing. So if you're weeing a lot at night and you're needing to drink so much, which is unusual at night, then maybe you should just double check. And you can just simply say to them that you're worried that you might be diabetic, and you know, you've been weeing a lot, you're very thirsty. Could they please check? That's it. They might frown, but they will still do it. It's their job to do it.
Thank you very much. So we've got 2 hands up, and then I think we'll move on to our closing section. So first of all, we've got Mary with her hand up. If you could unmute yourself, please, Mary.
Hello, yes, I just wanted to ask about getting children to drink water. And when he's being forced to drink water, he will have a tiny sip and then won't drink most of the day, which worries me. So then I end up giving the drink that they want. Is there a way of getting children to drink water, or is it better just to give them the juice rather than not giving them anything at all if they don't want to drink water?
So that's a beautiful question. My children are on this thing. They're on there, so they can testify to what I do to them. So I have a blue cup in my house, and they all know what the blue cup is. It's 400 ml cup. So I say to them, everybody, well, I have to reach you. I've just called your names. All of you come here. Go and fill your cups and come and stand in front of me and drink that water. Like, you know, like 2 years ago, there was this family in the school that they attend, and I noticed that, you know, kids talk a lot, and it's like, these kids don't bring Capri Sun to school, da, da, da. I said, so what do they bring? They said water. So what's in their snack box? They said cucumbers and peppers. I'm like, wow. And I was like, oh, Izzy, you're not doing well at all. Like, you're giving your kids crisp and all of this rubbish, and you're giving them Capri Sun every day to take to school, and you're sticking an apple, So I decided that we're going to take it out one after the other. So we took the Capri Sun out, and we just said, take a bottle of water to school. You don't need Capri Sun. And that's how we stopped buying Capri Sun in the house. So first things first, you have to be firm with these children. You have to tell them, you are the parents. You are the one who goes to work. It's your money you're spending. So this is how it's going to be from today. And also, I also feel that when they see you make effective, positive changes, it reflects on them. When I eat cucumber, they pick on my cucumbers. If I was eating chocolate, they will eat my chocolate. If they see me drinking water, now everybody has a bottle. The way I hug my bottle in my house is the way they hug their bottle. Because I'm not going to share my bottle, because you're going to drink from my 1,200 mils. So they carry their bottle everywhere as well. So good habits are copied, good habits are replicable. So I would say just try and start to show them, what drinking does. Make sure you take all of the rubbish drinks away from the house if you guys are not ready yet to start to bring them back in. And make sure you see them drink. But it's going to be baby steps. Like I said, we have to be patient with ourselves, because they haven't learned these habits overnight. It's been years now. So give them a few years to start to chop it off. The more they see good behavior, the more they will replicate good behavior. So maybe if you bought, if they had a pack of Capri Sun every day, make it one every other day. And then after a month, make it one every other 2 days. After 3 months, you just keep doing that until suddenly, and just when you're drinking, get them to drink as well. So everybody is drinking competition, whatever works, just get that water.
Creative. Thank you so much. It was worked out quite nicely for me with my son, actually, to put just a little bit of cordial in his water. Eventually you get rid of the cordial bit by bit, so like the squash or the dilute, whatever anyone calls it, sometimes that could be the way to ease them to the water zone.
Just keep going.
Yeah. We've also got a question from Blaji, and then I've got one more comment from the chat section, and I think we're getting ready to wrap up. So Bolaji, if you could unmute yourself, pretty please.
Hello. Oh, I'm so sorry. Hello.
Hello.
Yeah, it was a mistake. I really didn't have a question when the hand was raised. Anyway, I'll just use this opportunity to appreciate our Dr. Izzy, for that wonderful section, and you as well. Well done. Sorry about that. So just
oh no, please don't apologize, for goodness. Thank you.
Okay. Thank you.
Thank you so much for that. Right. So the one comment that I've got for the section, and I kind of have an answer for this, but I think it'll be much better coming from a doctor than my layman self, was someone said that they usually use their gauge of thirst before they drank water. So they usually feel thirsty, or even get beyond the point of feeling thirsty, before they get into the habit of drinking water. And I heard that once you feel thirsty, it's already too late. You're already getting dehydrated. I think it'll be better for you to, to expand for us.
That was right. You did. That's it. You just hit the nail on the head. And it's the same with food. Don't feel hungry before you eat. Because that's why when you get hungry, you would now overeat. So if you keep eating small meals. So when I started learning how to drink water, when I started teaching my brain how to drink water, I had a water app. So you can download one of those. It reminds you every hour to drink a glass of water. And a glass of water is 400 mils. So if you're going to drink 400 mils in the hour, so imagine in 8 hours, you would have drank almost, how much is that? 3,200 mils. So you just need to train your brain, how to drink. And then because by the time you're thirsty, you probably have a bit of a headache, a bit of a fog, less clarity. Your wee is probably yellow by now. My gauge for my wee is when I go to the toilet, I look in the toilet pan, and if my wee is as clear as water, thumbs up. If it's yellow, thumbs down, Izzy. You've not done very well today. So we need to make sure that when our wee is white like water. That's how it should be. And that just tells that our bladder, because what the water does is just cleanses your kidneys, and all of the impurities just go. So you're just getting rid of toxins, which is what we want to continue to do. And you see there's less toxins, less brain fog. You have, clearer minds, and it's better. I won't wait to be thirsty first. It's not a good idea.
Fantastic. I think that is us for questions. We've got a lot of compliments to you, just saying thank you so much, that it's been a really good session, a
Thank
lot of
you.
big ups. So thank you so much for your time so
Thank
far.
you.
And I'm going to pass over to Bumi we're going to do our quick, speediest brief overview, because I'm conscious of the time, as to what we are thinking in terms of the Khan Wigan project.
Thank you for having me, guys.
No worries at all. We really appreciate it.
Thank you so much. I don't even know which one I should do first. Maybe it's the appreciation or the overview. But I'll quickly do I'll do the appreciation first and all that. And then we'll just go to the overview, which is just a tiny bit of what we're looking forward to having for the vegan project. Thank you so very much, Dr. Izzy. Thank you for coming. Thank you. It's been an eye opener even for me. You know, some of the key points I've been able to get is that with good lifestyle, we can even reverse a lot of those, chronic illnesses that we may be dealing with and all that. It means that lifestyle matters. You know, I think we should go back with that acronym, like lifestyle matters. What we eat, what we drink, what we do matters. And, you've actually debunked some of those myths. Like some people say, oh, if you're on blood pressure, it's forever. Blood pressure, if you have high blood pressure, it's forever. If you have this, it's forever. It means it's actually reversible and all that. And I know that even, personally. It's not a question, but maybe it's something to go with. And you have said that if we sleep, if we don't have enough sleep, it makes people add weight and all that. I was thinking it's the other way around, but we're not going to go into that. Some people say like if you sleep too much, you add weight. It's like a myth and all that. And some of those things. But just to say thank you for coming. I hope that you would honor us again some other time. You've said so much. I'm sure everyone is leaving here more empowered. It's just been lovely having you. And before I go into saying thank you to every other person, I'll just quickly go through myself, and Aisha will quickly go through the overview of the Vegan Project. This is a platform for the Caribbean African Health Network. It's called CAN, and this is the Vegan Project. And what has happened today is what this platform is all about. And if you heard Izzy said one thing, he said this is a platform for us. I think I wrote it that this forum is where we can grow and grow in our strength and have confidence and know what we should do and what we shouldn't do. So a lot is coming into this program. Apart from, health is a major part of CAN, and it was established based on the health inequalities among the Caribbeans and Africans and all that. But a lot is going to be happening on the Vegan forum over the next couple of weeks. We're going to have a steering committee meeting. We're going to have talks about knowing our rights in the workplace, about managing our finances, about even doing business, about engaging with the public sector, about engaging with our community, which matters. I was talking to a friend and a brother who is on this forum, about even the education sector. That a lot of us, our children go to school and all that. We don't even understand this sector, to be honest. I am one person. I always say, like I said, my children have done very well and all that. My son will say, I'm thinking it. I've got a child who's had the first class. However, that was just the grace of God. I don't understand the system, if you ask me, and a lot of us don't, and all that. I've got another child in the university. If someone explain all these things, how did you get there? So we're going to have someone in the education sector who is going to be talking to us about what we should understand, what we should look out for, in the sector. So the next couple of weeks, I implore you to log on to the forum. We'll be sending in reminders and all that. It's going to be empowering. It's going to be a time where we connect even with other community-based organizations. Aisha, I don't know if you've got more to add or if I've mumbled. I've said everything.
You've said a lot. I don't think I need to go over anything that you've said. I do just want to mention that this is genuinely a forum that is incredibly flexible. There is nothing that has been set in stone. and it has to be informed by the people who are attending this session. It literally will not move forward. It will stall and nothing will progress if we don't get feedback. So while everyone is still here, I don't know how quickly or how swiftly you can, in the chat room, because I know last time we met, I sent out a form for people to fill it in, and I got the fantastic number of 6 people out of everyone who's attended filling out the form. So it may not be the best option right now, but even if you could just put it in the chat box directly to myself or directly to the Caribbean and African Network account, just your name and your email address and phone number. We'll make sure we get it extracted from there at a later time, so that we can contact everyone and make sure anything that is relevant to you, we can get to you. We also need your feedback. We need to know what you want to see. We need to know what it is that is to be created, what is necessary in Wigan, what is valuable for you. And honestly, I say it as there's nothing disingenuous coming from here. We really need you. So while everyone's still here and you're still available to chat, pretty please leave your details, because don't know how everyone gets information about these events. So we've got another, we have got Wigan committee meetings dates set up for the next one coming up. So these are for the people who are based in Wigan, who are participating and still part of our, who are part of projects and helping us get things going. That is going to be next week, Sunday. I have that right. Let me just double check again. But yeah, so next week, Sunday, at the same time, we're having the meeting where we are hoping people come with feedback, tell us exactly what needs to be what needs to happen. I have some ideas as to what I would want to see, and it'll be great to hear what everyone else would like to see happening. So just as an information, we're going to send out the invites via the contact details that we already have. Everyone, please, let us know. Let us know what you're thinking. Let us know what you would like to see more than anything else. We have got plans of other talks coming up. We've got plans of the type of people we want to come see us, but more than anything else, I just wanted to add that it's really important. This is interactive, that we're getting information from you, not just having things sort of like thrown out to you. I can see that Tolu wants to say something to us. At the moment, I've just seen your hand up, so I'm just conscious of the time, but lower your hand, please unmute and proceed as you need to.
Yeah, sorry, before I hand over to Tolu, just very fast, Tolu is one of the directors of CAN. I would let him say what he wants to say. I would also please ask him to please help us appreciate Dr. Izzy on behalf of CAN. Thank you.
Yeah, thank you, Bumi. Yeah, thank you, Dr. Izzy. I mean, you were just fantastic. I mean, your contribution is just priceless today, and I'm sure we're all going to leave here with loads of, more information to what we know already. I say thank you very much, and hopefully we'll see you again in the future, Zoom meetings that we're going to be holding here. Just a quick one just before we go. I think last 2 meetings ago, someone spoke about women meeting together with children. Small group of women meeting with children. From this group, I don't know if
might be the Kaya. I know we've got the Kaya group over here.
A small group of women that meet.
It's in Wigan.
Yeah, I just want to say. I have information of some funding going for small groups, not just for them, but any group in Wigan. As long as you're constituted, as in you have a constitution, you don't have to be registered. Even if you don't have a bank account, you can ask another organization to get the money for you. You can apply for money for this COVID-19 response. You can apply for anything up to £20,000. It's easy to fill the forms out. If you're struggling, I can help you. I mean, my job is community engagement anyway. I can help with applications for that. As I say, there's funding out there from the government, easy to apply for, and it's easy to, the criteria, just as long as you are more than one or two people meeting, you will get the money. You can apply for up to £20,000. So I'll send information up to Bumi to share with your.
Thank you very much. Thank you so much for that. We'll surely take you up on your offer.
Thank you very much, Tolu, for thanking. Oh,
All right.
it's
Yeah.
a privilege
Thank you
to
very
be here.
much. Thank you very much, everyone.
Yeah, thank you. We'll pass on. I think some members of that ICAIA, that organization you're talking, some members are they're on in this forum, and then would definitely pass it. I'm sure they will be in touch with you, to get more information. I'll pass on your contact details to you if that's okay, and they will be in touch with you.
That's fine. That's fine. Yeah.
Okay, then. Thank you.
Great.
So thank you everyone for coming. Thank you so much again, Dr. Izzy. Wonderful to have you. I'm sure we'll invite you to the Greater Manchester Forum. It's just been very informative, educative, and empowering. Would let everyone go. I don't know if Aisha has anything else to say. Bye-bye and see you again soon. Bye all.
Take
Yeah.
care.
Bye-bye.
Have a lovely week.
Bye.
Bye.
Yeah.
Bye. Bye.
Yeah, Aisha, can you wait? Yeah.
Yes.
Bye.